Hi, this is Dr. Ahtsham, and today I'm going to tell you about the OET speaking. So this lecture is gonna be a little lengthy as I'm going to start from the scratch, starting from the zero up to the advanced level, discussing each and every single thing and every minute detail you need to know about the OET speaking. So the examples I will be putting on as being a doctor that will be of the OET medicine, but as you know that the OET speaking, this is all about the communications. So the rules of the communication, they are the same and they applies to all, whether you are taking the OET, being a pharmacologist or either a nurse, that's going to be the same. Okay, so let's go into the real thing. Okay, so OET speaking. So first of all, so this speaking is not to check your knowledge. So knowledge carries a zero mark there. This is about communication. Okay, and by the communication what we mean is, okay, how you effectively talk to your patient or the next person. So communication is always a two-way process. Okay, if you are talking to somebody and he is responding you, that is the communication. It's not that you're just talking to some person and he is saying okay, okay, okay. That is not a communication. Communication is a two-way process. You need to involve the next person. That is the communication. So it is to check how effectively you can communicate. So OET speaking is about your effective communication and not about your knowledge at all. The next thing is that, okay, what is the setting? That is important because if you know what is the setting of your examination, you're gonna feel more confident at that day. Okay, so there are generally two cue cards. Okay, and you are given those cue cards separately. Okay, you enter in a room, there will be a person sitting on the other side of the table and you will be sitting on the other side. He will be giving you a cue card. You need to prepare that cue card for 3 minutes. Okay, first of all he's going to check your ID and he's going to give you the cue card and will give you a paper and a lead pencil. Again, we'll give you the 3 minutes to prepare that cue card, and then is gonna start the timer that will be on the table, okay, and the stopwatch and a recorder. So there will be a recorder and there will be a stopwatch. So you have to speak for 5 minutes to that person. Now, important thing is that that person is not a medical personnel. Okay, he is just a layman who can speak English. He is not even your examiner. You should be very clear about this thing. He's recording that thing, okay, and he will send this one to an examiner who is going to listen to you and going to mark you according to what you have done over there. So nothing to be confused about over there. Okay, that guy is just sitting in front of you. He knows English and knows nothing about your profession or even about the topic. So he's sitting on one side of the table, you are sitting on the other side of the table, and there is no third person. Okay, on the table there will be stopwatch, there will be a recorder. He's gonna give you a cue card with the paper and a lead pencil, and will give you the 3 minutes to prepare that. So after the 3 minutes, okay, he's gonna ask you that are you ready? Okay, and he's gonna press the stopwatch as well as the recorder. Okay, and if when you're done, okay, it's gonna stop the recorder as well as the timer. So this is the setting actually of your OET exam. So this is one cue card. Now you will come out of the room, you will go to another room, there will be another person, either a male or a female sitting over there with the same process. Okay. Now those 3 minutes, I'm going to tell you how you're going to utilize. You can write Okay, it's totally your choice. You're going to write something on the paper, or even if you don't write anything, you build a mind map. That's totally up to you. So this is as far as the setting is concerned. Okay, now this is how a cue card looks like. Okay, so there is a patient's cue card and there is a doctor's cue card. You will be given the doctor's cue card while that person will be having the patient's cue card. Okay, you will be given the doctor's cue card. That person is having the patient's cue card, but he knows your cue card too, because that is, he has to correlate the thing. So he knows your cue card as well as his cue card, but you only have your cue card. That is the doctor's cue card, okay, or a pharmacist cue card or nursing cue card. Now, this is how a cue card looks like. That is in front of you. Okay, so that's one of the patients, other is of the doctor. You can see the above here is the setting. Okay, it's a medical clinic or the GP or whatever, and then you have a scenario. Okay, and then you are given the points over here. Okay, this is how a cue card actually looks like. Okay, so now there are three cue cards, three types of cue cards as far as like for the medicine people it is concerned. There are three types of the cue cards. Let me tell you. So the first type of the cue card is where the patient is coming to you for the first visit. Okay. The second type of cue card is where the patient is coming for a second visit, or he is coming with some reports or for some lab results. And the third type of the cue card is when a mother is bringing her child, or an old person is coming with her daughter or his son. So there are three types of cue call. Let me tell you again. First one, the patient is coming to you for the first time. The second one is when he's coming to you for the second time. Okay, like 2 days back, it's given over there that 2 days back in your instructions over here, it's given that the 2 days back he came to you and he was diagnosed with some certain thing like asthma, and now he is uh, here for with some concerns. So that's the second. Or the other example could be that the patient came to you uh, just a couple of hours ago and he has swelling on her wrist, and you ordered an x-ray, and now he is back with those x-rays. Okay, so this is a second visit or with the lab results. And the third is that a mother is bringing his child her child, sorry, a mother is bringing her child, okay, because she's having some concerns. The first type of cue card and the second, they are the most common. Okay, where person is coming to you for the first time or coming with the test result. Okay, less common is when the mother is bringing her child, but there are the equal chances that it can come to your exam. Now, the important thing is that when I'm saying that a mother is bringing her child, will there be a child in your exam room? No, not at all. Not, there's no third person over there. Okay, so you have to talk to the mother. Why this is important? Why I'm telling you the different types of the cue card? Because the intro, okay, the way you're gonna ask, okay, about the identification, okay, you confirm the identity of the patient. This is different. The opening is different, okay, for every cue card. There are three different types. There are three different types of opening, while rest remains the same. Okay, why I'm saying like this? Because your exam is all about the communication. Okay, so you need to communicate properly and effectively. Okay, okay, let me elaborate this thing. Say for example that someone is coming to you for the first time, so it's a first visit. So you can say, hi, my name is Dr. X, okay, and I'm one of the doctors working at this, what is given at your setting. You're going to say like this, okay, I'm one of the doctors, or I am a doctor working at this medical clinic. I'm the doctor working at this GP clinic, okay. May I know your full name? Please always ask the full name. Always ask the full name. This is the mistake the people do. Not the name, but the full name, because you are checking the identity. And your age, please. This is the two things you need to ask, okay. And he's going to tell you his name and the age, and then you can say that, okay, um, may I ask what brings you here today? This is as far as the first one is concerned. Now come to the second, okay. Here, the person, you already know the person, like maybe 2 hours ago he came to you and you ordered an x-ray. So the nice way of talking to this person is like, from to begin with, is that, hi, I am Dr. X, okay, I'm the doctor at this clinic. May I confirm your full name and age? Okay, rather than asking that, may I know your name? Like, say for example, if somebody is coming to you 2 hours ago, and now is coming to you and you are asking again that, may I know your name? He's like, oh, what the doctor is asking about. So a nice way of doing this is, may I confirm your full name? So this is giving an impression that I already know you, but I want to confirm this thing, okay? I know you, your name, but I'm going to confirm, okay? So that I should not make any mistake, okay? And I'm talking to the right person or not, but I know you. So may I confirm your full name and age, okay? While dealing with the third one, this third type of cue card where mother is bringing her child, okay? So you start differently. Hi, my name is Dr. X. I'm working as a GP. May I know your name? She's going to tell you some name, and now I believe that you are here for your child. She's going to say yes. Okay, may I know his or her full name and age? Now here you need not to ask about the mother's age. Now look how inappropriate it's going to be. Like, the mother is coming to me for the child, and I'm saying that, may I know your full name and age? I have got nothing to do with the mother's full name and the age. Okay, my patient is that child. So the starting is different, okay. May I know your name? She's going to tell you names. So you are like, I believe that you are here for your child. If I'm not wrong, you are here for your child. She's going definitely going to say yes. Okay, may I ask her full name and age? So these are the three different types of starting, okay, and you need to imply to make your communication effective. Okay, so far we have discussed what the OET speaking is, okay, what is the setting, and what different types of cue cards are there. Okay, now comes the real thing over here. Okay, so your speaking is actually the communication you are doing over there. It's not the speaking, it's not about your knowledge, it's the communication. Okay, now here I'm going to tell you the certain points which you need to incorporate in your OET speaking. No matter whether you are taking the OET medicine, being a doctor or a pharmacist or even a nurse, you need to incorporate these points. And these are not devised by me, by the way. These points are there in the instruction manual which is given to you by on the OET side, okay? How they actually mark the OET. So this is just a summary. How there are like so many points over there, 50. You cannot incorporate them. But this is just a summary of that one, including all those important points which you need to take care of. So the first thing is intro, that I have already told you how you're going to introduce yourself, and how you're going to identify the patient. And that is different for the different cue cards. So how you're going to identify. This is the first thing, intro. Okay. The second thing, which I emphasize actually, okay, is learn to say a thank you. Please learn to say a thank you. Like, hi, my name is Dr. X. I'm one of the doctors at this clinic. May I know your full name and age, please? He or she's going to tell you something. Then the very next sentence should be, thank you for coming today. It seems really nice, okay, building a relation with the patient. This is how the communication works actually. Thank you for coming today. Now, some people, they try to say something like that, nice to meet you. Don't say like this. This seems very inappropriate. Okay, somebody is coming to you with a broken arm, okay, and you are saying, or a pain in the abdomen or the chest, and you are saying that nice to meet you, not giving a good impression at all. He or she is not feeling good, or it's not like nice to meet you. It's kind of what the doctor is saying. I want to come to a hospital, but I came for this thing. Learn to say instead, thank you for coming today. Okay. The third thing is empathy. Empathy. As soon as you ask a problem, she's going to tell you some problem. Okay. You need to express the empathy. Empathy is like you feel the same way as the patient is feeling. Okay. Like, I'm so sorry to hear that. This must be troublesome for you. I'm sorry. I can see that you are going through a hard time. So, empathy, whenever, anywhere in your speaking, the patient is telling you something which is making him or her worried, okay, always show the empathy. That is important. If you're not going to show the empathy, they're going to detect your mark. So, show the empathy, and the right time is when you ask about a problem. Okay, there you need to show the empathy. I'm so sorry. This must be worrisome for you. This must be troublesome for you. I can see that you look worried. Okay, and then give a little reassurance as well. Okay, like, I'm so sorry to hear that. Okay, don't worry, we're gonna help you. Okay, don't worry, I'm gonna look into this matter. I'm gonna see that how we can fix this thing. I'm gonna look into this matter, and we'll try each and everything that is best possible in your interest. It's a little bit of reassurance to gain the confidence of the patient, to gain the trust of the patient. Okay, so this is the reassurance. That is the point number 4. And if you combine it with the empathy, that's going to be very fine. Okay, the next thing you're going to do is, in during your speaking, check for understanding. Okay, check for understanding. Am I making sense to you? Okay, this is the way you check the understanding. Say, for example, you are explaining the diagnosis to a patient, and now you're speaking and speaking. Maybe you are not making any sense. Keep on checking the understanding of the patient. Am I making sense to you? Are you with me up to now? Is there anything that is not clear so far? This is checking the understanding of the patient. That is important. Now, the next thing you're going to do is point number, let me see, that's going to be the point number 6. That is the ask about the concerns of the patient. Or you can say it like this: questions. Do you have any other question? Do you have anything that is still bothering you? Okay, and at the end, at the end, okay, you should be having a proper fine ending. How are you going to do that? Okay, thank you for coming today. I wish you a very healthy life ahead. I wish you a speedy recovery. If you have any query, please feel free to contact me. There should be a proper ending. Okay, you can still like this. Okay, say thank you at the end again. Thank you for coming today. If you still have any query, please let me know. I wish you a very speedy recovery. So these are the things actually. These are the points which you need to incorporate into your OET speaking to make it a proper communication. Okay, I'm going to summarize it again. So introduction and identification. You need to identify the patient, and that is different for the different Q cards. Three types of the Q cards I have discussed. Then the next thing I want you to do is to say, thank you for coming today. Okay, and you ask about the concern, and then he's gonna show you some concern, and now what you do that you show the empathy and reassurance. Okay, then you check the understanding of the patient as you proceed in your OET speaking, okay, your Q card. And then you check about the concerns or the questions, and then a proper ending. So intro, thank you, empathy and the reassurance, understanding, question, and the proper ending. This is the way you're gonna communicate in your OET speaking. Okay. Now there are the important things. Okay. When you are sitting over there for the 3 minutes, when a cue card is given to you for the 3 minutes, okay, you have to prepare, and then you need to speak for the 5 minutes. Okay, the people ask that what we need to do we need to write? Well, that totally depends on you, but writing, that is not the wise option, I believe. Literally it takes you like 1.5 minute to 2 minutes to understand that cue card, okay, and to formulate something in your brain. And if you start writing, you would barely be able to write one or two sentences. So this is not a wise option. I'm not saying you do not write, that totally depends on you if you can, because the things are different for different people. But mostly it's not a wise option, literally, for so many people, because you would hardly be able to write something. Okay, rather than what to do, how to utilize your 3 minutes, what you need to do in your those 3 minutes. So 1 minute and a half minute, 1.5 minute, you will be understanding, okay, what your cue card is and what you need to do. Work over these things, work over intro, build a mind map, okay, store it in your brain that what you're gonna do after like 3 minutes, okay, how you gonna start it, okay, think about the intro, how I'm gonna start. Then the next thing is how I'm gonna show the empathy and the reassurance. This should be in your, you should be thinking about this thing in these 3 minutes if you want to effectively utilize your these 3 minutes. Then think of diagnosis. If there is a diagnosis, like if it's written over there that you need to explain the diagnosis to the patient, think about the diagnosis, how you're going to explain this diagnosis. Okay, and please explain the diagnosis in very simple language, in layman terms. Say for example, okay, the case is that the person is having the appendicitis, and you need to explain that what it is. So a very simple way of explaining this thing is that, okay, in your tummy or in our tummy, there is a finger-like structure that is called appendix. Sometimes it get inflamed, okay, resulting into the pain and the vomiting what you are having exactly, and this is called appendicitis. So if you look at what I said actually, okay, is that I have explained it in a very simple way, okay, rather than saying that in your small intestine and large, the patient doesn't understand this thing, okay, in a very simple term, and then I linked this thing with the complaints he is having, that it gets inflamed, resulting in the pain and the vomiting, exactly what you are having, and that's called appendicitis. This is a good way. Say for example, it's asthma. So this is a condition that is related to your lungs. The first statement should be like a broad statement. Okay, what is angina? It is a condition that is linked to your heart. Okay, what is appendicitis? It is a condition that is linked with your tummy. Then explain actually, okay, what happens that your airways, they are hypersensitive to some of the stimuli, either dust, mite, or something like that. So whenever a person is exposed, whenever a person is exposed to such stimulants, their airways react, okay, and they become narrow. And this is exactly what has been happening to you, okay, you are going through, and it results in a whistling sound and difficulty in breathing, okay, exactly what you are having. So try to explain it in a simple way and link those sign and symptoms with the patient's symptoms. This is how he gonna understand this thing. So work over this diagnosis, that how you gonna explain, and believe me, it will easily utilize your, okay, like 30 minute seconds, 30 to 45 seconds, and keep on checking the understanding of the patient when you are explaining the diagnosis, okay. It is a, like, it is a condition that is related to your lung, okay. So what happens that when a person, okay, the a few people, they are sensitive to some of the stimuli. Are you with me up to now? Okay, then I put another two, three, four sentences, and then I'm again checking that, am I making sense to you? So keep on checking the understanding. This is how you're gonna tell about the diagnosis, okay. So work over intro, work over empathy, okay. Think about how you're gonna tell the diagnosis, and then there will be the treatment, how I'm gonna tell about the treatment, and there will be, like most of the times, there are the preventive measures as well, or there are some like CBT or some graded exercises. So rather than like writing over there, work over these points, okay. How you gonna start your conversation, how you gonna show the empathy, okay, how you gonna tell that, hey, okay, there's a diagnosis in my cue card, okay, I'm gonna simply diagnose it in a layman term, okay. Then how I'm gonna tell the treatment and the preventive measures. This is how you're gonna go, okay. So now there are the certain things which I think I should tell you, because there's a confusion in a lot of candidates about those things, okay. The first thing is that, okay, as I have already told you, that there is no third person. Even it's a cue card of a child with a mother, there is no third person. There will be the examiner sitting over there. The second thing is that, okay, can I see on my look at my cue card? Yes, you can look at your cue card. Okay, there is a recording of your voice. Okay, that is sent to the examiner. You can look at your cue card multiple times. It's very okay. Okay, you need to look at your cue card. That's how you're going to proceed. Now the third very important question is that, can we go here and there, like on our cue card, or do we need to exactly follow the points? Yes, the thing is that you can go here and there as well. You can add the things from your side as well, like explaining the diagnosis. Okay, there will be the written like 2 or 3 words. You can explain it your own way, but do not stray away. Okay, you can go a little bit here and there, and then you need to come to your cue card. Okay, and the supporting evidence of this thing is that your cue card, if you need to speak it like that, what is exactly written over there, you can finish it in 2 minutes. Definitely you have to expand it, and you can go a little bit here and there, but that should be linked to your cue card. But importantly, you need not to stray away that now you have started talking about the other things, okay, which do not belong to your cue card even, and you have totally gone away. That's going to give an impression that you have memorized the thing. So don't do like that, but you can go a little bit here and there, and you can expand your case notes. That's very okay. Okay. So the next question is that the people are having in their mind is that normally the 5 minutes are more than enough. You can finish your um, cue card in 5 minutes. Can we discuss the, like, let me go to the cue card. Okay. Do we need to discuss these points in the order in which they are given? Yeah, it is good to follow the order. Okay, but if the examiner is asking you, it's not the examiner, by the way, that person is sitting over there. You can go up and down. It's okay. If by chance this thing happens, it's okay. So you need not to confuse yourself over there. Try to follow these points, okay, in the order, because you will be feeling more confident then. Okay, the very next thing is that, do we need to finish all these points? If we are left with one of the point, are they going to deduct your marks? Normally you have enough time. Okay, you can go through all your points. The thing is that, as far as you are communicating effectively, even if you are left with one of the points in between, it's okay, it's very okay. They know this thing. Okay, so even if you miss one point, but you were communicating effectively, you were involving that person in your talk, that's fine. You can miss a point. It's okay. Okay, now another very important thing is, okay, the people, they ask about, like, literally I have seen that in between they say that, okay, let me examine you, let me examine you. There is nothing examination over there. Like examination, you need not to incorporate this thing from your side. That is giving an impression that probably you have memorized the things. Okay, they say that, where is that, I haven't seen, like, examine the patient. Okay, and they say at the very next, again, after taking a history, if there is something, let me examine you, and they are like just thinking in their mind that they have examined. Okay, they are supposing those things. So don't say, okay, that let me examine you. This is coming from nowhere. Okay, don't say this thing. Okay, this is foolish, that let me examine you. Okay, they do not involve this thing. They want you to communicate. Okay, they want you to communicate. There's nothing like that. Okay, that let me examine you. Okay, now I would like to examine you. Again, there's nothing like that. Okay, don't say something like that. Okay, now there is another important question that, some people, okay, some candidates, they are that you need to summarize. Okay, do we need to summarize? You need to summarize, okay, only when you have, you are finished with your cue card, okay, and you are left with like 1.5 minute, 1 minute or a half minute, sorry. Okay, but you need not to summarize in each and every cue card. That is a wrong technique. Okay, you need not to summarize. This is not important. This is not obligatory that you need to summarize every cue card. This is a trick when you are finished and you are just left with a half minute, or in a pretty bad thing like in a situation in 1 minute. Normally, if you have spoken, okay, for 4 minutes, you are in a safe zone, so you need not to worry. Okay, yes, you can summarize if you are left with a half minute, okay, or 1 minute, okay, but please do not summarize, okay, if you are just left with a half minute and you are leaving the ending and you have started summarizing the things, okay, proper ending, okay, like thank you for coming today. Okay, if you have any query, please let me know. I'm wishing you a very healthy recovery. This is far more better than summarizing, leaving the ending and just summarizing. Summarizing is not an essential part of your OET communication, but you can summarize if you are left with like 30 seconds or something like that. And whenever you are summarizing, please summarizing just like 4 or 5 sentences. It's not like that you are starting from the very beginning and telling the whole story again. Just one line, okay, just making 4 or 5 lines. If you are summarizing, maybe you are left with, say for example, 45 minutes, and now you have started summarizing and now you are telling a whole story. For 45 seconds you are speaking and you are not involving the other guy who is sitting over there, the patient who is supposed to be a patient. You are making a grave mistake. Please don't do this thing. And when you are summarizing, just 4 or 5 sentences, and always check the understanding. Always check the understanding. So these are the important things actually as far as the OET speaking is concerned. So OET speaking is a communication, okay? Please apply those 6 7 points which I have told you, because this is gonna convert your OET speaking into your communication. Otherwise, you are just speaking, and you will not be marked on speaking. I have seen the people literally, they are very good in speaking, but they fail the OET speaking. Why? They were not communicating, they were just speaking over there. And you will not be giving the marks on your medical knowledge or your speaking only. They are not checking. The guy who is sitting over there, or even your examiner, he's not a doctor. He is just a person who can speak English and who knows English. Okay, he's checking your communication. The purpose is that you can communicate with the patient or not. It's not about your knowledge. So keep this thing in your mind. So these 6 7 points, these are from go to the OET and check the speaking criteria. Okay, how they're gonna mark this thing, and these points are over there. These points are there. Okay. Lastly, an important thing that is coming into my mind is actually we discussed about the second type of Q card, where a person is coming to you for the second time. He's coming for the X-ray results, say for example. Okay, here you will start like this: that hi, my name is Dr. X. I'm one of the doctors working at the clinic, or at this GP clinic. May I confirm your full name? May I confirm your full name and age? Is going to tell you. Now, how you going to start? Okay, uh, I can see from my case notes that you came here for the pain in your wrist. Is this so? It's going to say yes. Okay, and we ordered an X-ray, and you are here with the X-ray results. Am I right? It's gonna say yes. And now you need to start. You were diagnosed with the asthma. Just put a statement and then confirm rather than telling the whole story. Okay, that you are diagnosed with the asthma and we gave you this, and that treatment, and now you are here. No, just single sentence. Just confirm that one and then tell the story. This is called establishing what is already there. You need to do this thing if somebody is coming to you, literally, because this is called establishing what is already there. And if you go to the OET criteria of the speaking, this is over there. You need to establish what you already know. So in the second type of the Q card, which I discussed with you, okay, you need to go like this in the intro. For the first, I have told you. For the second, I have elaborated. For the third, you already know. Okay, you need to just ask about the name, and then full name and the age of the child. Do not ask the full name and the age of the mother. You have got nothing to do with that. So this is as far as the OET speaking is concerned. Be confident. The guy sitting over there is not someone who knows, who is from your profession. Okay, he is just a man. Okay, who is conducting the exam. He knows the English. He knows his cue card, and he knows your cue card only. That's the thing. Your exam is marked by and is checked by someone else. So you need to be confident. Okay, if you're gonna be nervous, okay, this is the biggest harm you can do to yourself. And practice, practice, and practice, because these 5, 6, 7 points which I told you, you need to incorporate into your speaking. And how you're gonna do that? This is not a one-day job. You need to practice, practice, and practice, because in the UK they speak like this. Okay, this is how they communicate with their patient. And most of you will be taking the PLAB 1 and then PLAB 2. Okay, PLAB 2 is all about this thing. This is how you communicate. If you have a very good communication skill, your chances of passing that exam, they go quite high. So this is as all about the OET speaking. I hope that I have dealt each and everything, because this is all you need to know about the OET speaking. Okay, and these are the details. If you do have any question, then you can ask me in the comments. I would love to answer that. Thank you.